Thank you very much for your comment. I'm not sure I can answer your question completely, but I'm going to try. You're asking, isn't booze an even bigger health hazard? Why is that being ignored? The effects are deadlier. I think booze has long been established as a drug of abuse. It's there in the diagnostic criteria in all the manuals. Alcohol use disorder is one of the most common drugs of abuse. In fact, in our rehabilitation facilities, one of the most common reasons or common drugs that people are seeking care to recover from is alcohol dependence, alcohol addiction, alcohol use disorder. So there's a lot of evidence, there's a lot of awareness, there's a lot of research around alcohol. There are a lot of warnings about alcohol, but people still use it. And so I don't think it's more on the part of the people who enforce laws on alcohol use, but rather on the people who consume it. And perhaps one of the things that we might look at is when we say that alcohol is bad for your health, and there are people who drink it and don't get adverse effects from the alcohol, then people tend to think that scientists don't know what they're saying, because I've drunk it for 10 years and I've not been addicted to it, nothing has happened to my liver, my pancreas is okay, I'm not diabetic, I'm not hypertensive, I'm not getting any ulcers, I'm not getting any effects from the alcohol. And so I don't think it's a question of being ignored per se, it's just that alcohol is established as a drug of abuse and people still use it. Warnings are there. Now we're saying there's no amount of alcohol that is good for your system. But when we look at CDC in the past, it had recommended that men can take 1 to 2 beers per sitting and women can take 1 beer per sitting. But now research is telling us there's no amount of alcohol that is good for your health, and people are still using it. I think the comparison between alcohol and miraa is that miraa has long been known as a way of socializing in different cultures. And so in those cultures, chewing miraa has been very normal. And remember, with migration, you see that the same people in those cultures move to other countries and perhaps spread the use. And so now that we're seeing the different effects of hearts, of the problematic behaviors that arise because of using heart, now we're having a discussion of perhaps adding heart onto the list of drugs of abuse. Perhaps now the attention is on heart, but for alcohol, it's already been established that the effects are deadlier. We have up to 2 million deaths a year in our country as a result of alcohol use disorder. Some studies have quoted that the prevalence of alcohol use in our country, some range it from 6%, others take it up to 10%. Prevalence, meaning 10% of all Kenyans have an alcohol use disorder. Some studies have quoted that. That may translate into 1 out of 8 people have an alcohol use problem in our country. So people are aware, or people might not be aware of the effects of alcohol, or they're aware and they're ignoring the effects, because the negative effects, because remember, alcohol a lot of time is used because of the reward system activation in the brain. You might find somebody drinking alcohol because they're feeling stressed, drinking alcohol because they're feeling sad, because they're feeling lonely, because they're avoiding confrontation, because they don't want to perhaps stay with their own thoughts. People use alcohol for different reasons. And it's one of those things that are easily accessible and easily available. So I don't think that alcohol as a drug of abuse is being ignored. I think that it's well established that it's a bad drug to use, but people still use it. But now the focus is on miraa because people are trying to understand the negative effects that people chewing miraa are experiencing, and if that could be strong enough to add it to the list of drugs of abuse.